Thank you very much. I'd like to thank the organizers once again for the kind invitation to this conference. I would like to talk today about the point-of-care technologies used for healthcare and well-being application. This research is realized at the Applied Nanotechnology Research Group, which is part of Saxion University. Saxion University of Applied Sciences is one of the largest institutions of higher education in the Netherlands. It's situated in 3 different locations, and at the moment there are about almost 30,000 students, from whom about 3,500 are international students from 75 nationalities, and about 3,000 employees. There are a number of research areas defined within our university, like areas in living, health and well-being, and a smart industry. And what is typical about the research that we perform is that we're looking especially at interdisciplinary and practice-oriented research. Applied Nanotechnology Research Group, one of the research directions of some of them are listed in this slide. As I said, within applied nanotechnology, we look at the interface between micro and nanotechnology and life sciences. At the moment, we have a number of projects related, for example, with molecular sensing technologies, especially development of different kind of biosensors. Lab and organ-on-chip technologies is another onderzoek. Is another research line. We look also at the nanostructure surface and nanomaterials, and on top of that, there are also some projects which are related with societal embedding of nanotechnology, and also about the risks and this kind of research. Within the molecular sensing technologies, as I shortly mentioned, we are working in the development of sensitive and specific detection of various analytes, which could be, for example, different kind of biomarkers, but also microorganisms. We focus in development of demonstrators for specific applications. And some of the areas that are related to this project are especially medical diagnostics related to diseases like cancer and heart diseases, but also food safety and environmental monitoring. They play an important role. So if you look at the biosensors in general, the kind of ultimate biosensor should be able to measure different kind of biomarkers and bacteria and viruses. Could be protein, but also could be a DNA molecules. Preferably in a complex medium like blood, serum, saliva, urine, milk, etc. It is necessary to measure at a low concentration, but yet with high resolution. And also, it's desirable to have on-site and real-time testing, which is related to the so-called point of care. I've listed here a number of diagnostics requirements related to this type of biosensor, different methods working in this field. Some of these requirements are high specificity, which are related to detection of low concentration of a certain analyte of biomarker. Good specificity gives us the possibility to detect the analyte of interest. We'd like to and prefer to have rapid testing, like online real-time monitoring. Multiplexing capability is an additional feature that has to do with the fact that we'll be able to measure several analytes. It's also differently called sometimes panel testing. Standalone operation is related with the portable and realization of portable handheld devices. Of course, you'd like to have this at site, sometimes all inline monitoring, for example, during the production process. And of course, low cost of production operation. It's desirable. If you look at the current methods that are used, especially in the field of diagnostics, but also in the food safety, we have detection of bacteria. For example, still one of the gold standard is a plate count, in which bacteria growth it's occurring in a petri dish, and sometimes we have to wait several days to achieve results. The next to that, there are some more advanced techniques. ELISA is a technique that's used especially for detection of biomarkers based on a protein antibody antigen interaction. And polymerase chain reaction PCR is also related to the detection of microorganisms, especially when you look at the DNA of a microorganism. Both these methods are relatively expensive and they require intensive sample preparation. And there are methods that can be used only in the lab, so that these methods are not suitable for point-of-care testing. Recently, basically in the last 10-20 years, there is a development of different methods based on different principles like nanowires, surface acoustic waves, magnetic bits, atomic force microscopy is another method, rapture event scanning, etc., which are trying to work towards the development of the point-of-care system. However, so far, no system is available yet, and these new methods are under development. Next to these new nanotechnologies, there is also a technology based on lab-on-chip photonic biosensors, in which there are a number of different methods and different configurations developed during the last 10 to 20 years, starting from a multi-channel Young interferometer, shown left, micro ring resonator in the center, and whether a symmetrical of asymmetric Mach-Zehnder interferometer. All the principle of detection principle of this method is based on evanescent field detection. So basically, if we have a cross-section of one of these channels, then we see that we have a guiding of light through a three-layer waveguide structure consisting of a core, cover, and substrate. In order to guide the light through this waveguide structure, we need to have the refractive index of a core layer higher than the core and the substrate. And during the propagation of these light modes, then we see that there is an influence of the refractive index change in the neighborhood, in the interface, near the interface between cover and core. And due to the interaction, then we have a local change of refractive index, which causes a change in the speed of light. And this can be measured as in different principles. Here in this first configuration is measured as a change of the phase of light. In the second configuration, it can be measured as a change of wavelength of light, in the case that different wavelengths are being coupled in. And in this case, it's measured as change of intensity of light. So all these different methods are based on evanescent field detection. It's important to mention that we have, in this case, then we show once again the relation between detection of a bacterial cell. In this case, it is multi-resistant Staphylococcus aureus, which is one of these so-called hospital bacteria. And then we have, which is about a few micrometers large. Then we have a virus, a few hundred nanometers, and protein, which is a tenth of nanometers. And this is how it looks like on scale if we have the evanescent field detection. As long that we would be able to find a receptor against one of these biomarkers, then we can then be able to detect them specifically. One of the techniques that we use in our lab are micro-ring resonators. In a micro-ring resonator, basically the light coupled into an integrated waveguide channel, and then it couples also in a ring resonator, which is positioned with the evanescent field of the first channel. Then we have the light propagating in the ring, and then there is another channel which is close to the ring. Then we have a part of a light again coupled here. In case then we have an interaction in the neighborhood of the ring, then we have a change in the intensity of light that is coupled by the low intensity of light that is measured in the second channel. This is one of the chip configurations that we are using at the moment. Here in this configuration, we have 8 different ring resonators. One of them is used as a reference. The other 7 ring resonators are used as measurement channels. This is a lab prototype in which the outlining of the chip is done using a XYZ stage, but also we have another prototype in which outlining of chip is performed automatically via the software. This is a different type of biosensor based on multi-channel interferometer. Basically, in this case also, we have an integrated waveguide structure in which we couple laser light to the input channel, and then using some Y-splitter functions, then we split the light to different channels. The light coming out, in this case, we have divergent beams, which overlap with each other, and the light is focused through a cylindrical lens to a CCD camera, and the interference pattern is analyzed, and then we can calculate back what is the amount of for example, virus particles, or another type of biomarker that is bound in one of the measurement channels. This is a prototype of a lab-on-a-chip system in which the optical chip is integrated with fluidics, and this is one of the first prototype of a readout detector that we have developed, and this is the heart of a system in which we see the optical lab-on-a-chip system. We have the fluidic system for flowing different liquids. We have a part in which the laser light is coupled in, and we have a part in which the CCD camera is positioned somewhere here to record the interference pattern. If you look at the different applications that we can study, then they can be divided in some different applications. One of them is early disease diagnosis, like detection of cancer biomarkers. The advantage is it's clear because we would like to have a high probability for the disease curing. If you are in the early process, then curing of disease is easier, or there is a high probability. We also have some high cost savings because then in this case we use less treatment and medication for curing of these diseases. Also, it can result in improvement of patient life. Our applications are, for example, point-of-care testing, in which detection of biomarkers is very important, are this kind of tests that we call sometimes lifesaver. Food safety, the detection of bacteria, where it mentioned, but also national security for detection of viruses, for example, at airports. It's quite important. This is kind of validation strategy that we use in during our projects. So first, for a new type of application, we select the proper receptors to achieve high sensitivity. We optimize the chip coating to achieve high sensitivity. Then the test will continue by measurement of different light concentration for sensor calibration. The last two steps are related with benchmarking with gold standard methods. So if you develop a new method, then we always benchmark it with the gold standard methods. And then last but not least, it's the testing with clinically relevant patient samples in order to evaluate how this method works. One of the methods that we use for chip functionalization is based on the hydrogel methods. There is a method that's been used for bringing or immobilizing receptors to the sensor surface. This hydrogel layer can be chosen based on the type of application. And also, if you are interested, for example, detection of large or small particles, in this case, we can change the density, varying from low to the dense layers, but also the thickness of this layer can be changed up to about a few hundred nanometers. In our lab, we have different equipments that we use for development of this assay, starting from an ELISA reader to a spotter to also an SPR instrument. This is one of the label-free instruments that can be used also for benchmarking. And we have different prototypes of photonic biosensors based on microresonator, magnetic interferometer, and multi-channel ion interferometer. This is an example of different projects that we are running at the moment. We have projects that are focused especially on the medical diagnostics, like COVID-sense related detection of COVID-19, Diamond 2 Diasense related detection of insulin, which is relevant for diabetes type 2. Also, we have now projects in the field of food safety. The COVID-sense, let me show some results that we achieved during this project. It's a collaboration with Medlon Lab, which is part of New Labs. So we all know the situation about this COVID-19 pandemics, which is related also to different kind of pandemics that we have seen also in the past, like SARS and other pandemics as well. One of the methods that has been used during these pandemics was this rapid test based on lateral flow assays, in which you always have a test line and a control line. And that control line tells you something about the validity of the test, and the test line says something whether you are infected or not. Although there are different methods have been used from two main players, Abbott and Roche, we see that there is a difference between what is claimed and what this method can achieve in reality. So basically, there is need in this kind of pandemics to have a method in which really can perform a test in the point-of-care setting, but also to have the lab testing quality, which sometimes with this rapid test can be achieved due to the fact that they are less sensitive. One of the ideas that we had during this project is to perform a kind of serological test in which to detect first antibodies, but also the virus itself, because this is a kind of this is a typical graph in which you see that what happens in case of the infections on the early stage is called asymptomatic stage. We have an increase in the concentration of the virus, but it takes about 1 week before our body can start to produce these antibodies, which will protect us later on. And this shows that we have a peak in detection in the concentration of the virus, which falls later on. The higher the concentration of the body, then lower the concentration of virus. But the way how this concentration of antibody states tells you something about how good are you protected against this virus. So one of the things is that you see that the concentration of virus in the early onset is quite low, and you need sensitive methods to detect the virus. And this, one of the methods to detect this virus is to look at the spike protein. So these are the so-called biomarker proteins which are positioned at the outer shell of the virus. One of the tests is performed in the detection of this, detection of these antibodies. There is a test in which a chip has been coated with so-called anti-region binding domain, and then later on, different antibodies are applied, IgM, IgG, and IgA. We see a reaction of the sensor, and we see also that the detection of the signal that we receive when IgG binds is higher than the other two as expected. We did also kind of negative test with other proteins, and we see that there's minimal binding. Also, it's worth to mention that these antibodies were present in the BSA, so it's a complex medium. And Diamond 2A is another project in which we have done performed some tests and would like to start a new project with our partners, which is basically related to diabetes type 2. It's one of the third causes of death in the Western world as well, and we see that the worldwide about 17, this is from 2019, but about 20% of healthcare costs go to diabetes, and the prevalence is rising exponentially. The idea is that by developing a method in order to detect not only the glucose concentration but also the insulin, because the insulin gives us some information in very early stage compared to the glucose, which means that in this case there's a high chance that this disease should be reversible. So in this case, we'd like to develop a new method which is based in using, in this case, the lateral flow method, which is in a multiplexing method, and in which not only can be used for qualitative method but also for quantitative methods. So in comparison to the rapid COVID-19 test, in this case, then we'll work in a method which quantitatively can measure the concentration, and also different parameters at the same time. And this would be also realized, and it could be communicated, let's say, via an app, in order that somebody can monitor his conditions and then can do something about for example, having some more physical activity, to use a better diet, and also to have less stress and enough sleep. This is a kind of definition of different work packages. We have a proposal at this moment that we hope that we'll be able to work with different partners, starting from knowledge institution companies, but also social and other partners. So to conclude this presentation, using photonic biosensors, it is possible that to perform the test of so-called point of care, which can give us all the possibility, due to high sensitivity, to have lab quality testing. This method is much cheaper and easy to use, can be faster, because due to the use of different software and sensitivity, you can perform sampling and send out. Yes, I'm concluding. Technology is also amenable for mass production. And just once again, we are working with different projects, and we have seen that we have different partners and working with different international research institutions, industry, and end user. And this concludes my presentation. Thank you very much for your attention. I don't know if there is any question.
If there are any questions among the audience, then
I go there.
you can have a seat here itself. Yeah.
Let's see. You see me or
well, then you can. I'm so sorry.
Can you see me or can you hear me?
Yes.
Okay. My question would be about the last part, the insulin detection.
Yes.
I mean, that sounds interesting. So I know how it goes in like the hospitals right now, and the blood, the sugar like test.
Yes, the glucose concentration and the insulin concentration, right?
Sure. So 2 questions. So when do you propose it's going to be working, and the second, but how it's different? So I guess the people try to measure it with this flow assay already. So what's the method? Is new and
well, the idea. So at the moment, the current gold standard of let's say monitoring or diagnosing somebody with diabetes type 2 is based on the measurement of the glucose concentration. As I showed in this graph, the glucose shows a rise in the concentration only at the moment when somebody goes from pre-diabetes to diabetes. Why this happens is that basically the change of the concentration of glucose starts much earlier, but our body produces insulin which lowers the glucose concentration. Only at the moment when the insulin cannot lower anymore the glucose concentration, then you see a drop in insulin concentration, increase in the glucose concentration. So by measuring not only glucose but also insulin, we can much earlier, a few years earlier, see an increase in insulin, which is an indication that somebody could develop diabetes type 2, especially for insulin-resistant patients. And in this case, somebody can use, for example, this lateral flow method. It will be very comparable to this rapid test that everybody has used at home. Then you can do a test and you can look if there is a rise or a change in the concentration of the insulin. And based on these results that and this can be also developed a kind of sensor, then it gives some advice, the software, that maybe you have to change the diet, or you have to consult with your GP, or you have to talk to, for example, these lifestyle coaches that you have nowadays. And then you can tell you a little bit more what kind of activities you have to perform, what you have to change in your daily activities such that you can, again, try to decrease, let's say, the insulin levels. The method, we have done some preliminary tests already. There is a running project also at the Wageningen University in which we work together. We have a proposal at the moment. Then if the proposal then will be granted, then we hope then in the next 4 years we'll work for development of this method.
I mean, it's just one comment, not a question. It's at least in Hungary, in pregnant care, they're measuring the insulin already, so that's why I think it's important. And because we just been there with my wife, and I know that they're like every 2 hours they get whatever large amount of blood from who already like have all the troubles or any of troubles. So that's why it would be very useful.
Yeah. Is it measured there at the point of care, or is it measured in the lab?
The lab. So that's why it's... So what they do, they take the blood, they wait whatever 2 hours, take enough blood and get the test. So that's why. So they already realize that the insulin is important, but they still don't have the right method to measure the effect.
I know that it's possible to be measured in the lab. Only the problem that you see sometimes is that, and we talk with the hospitals as well, that it does not happen that much. So it's not that much accessible. So, by the way, you cannot just go to your GP and say, I want to measure my insulin, because you don't have symptoms. So the idea is to develop a test in which people can use, preferably at home, even if they don't have symptoms, because they are in a very early stage in trying to reverse this disease. And it's not really the diabetes maybe the problem, but it's the complication with the heart diseases and other diseases as well, which makes it as a kind of, very crucial to detect diabetes, because if you are in an early phase, then it's the high probability that you can reverse it much faster.
Good luck.
Okay, thank you.
Thank you.
Are there any other questions? Thank you, Professor.
Thank you.
For your time and your valuable insights on the research.
Thank you.